We're really thankful that you guys are taking time to be with us today to learn more about fetal movement monitoring. These baby faces here, we are all about the babies at Healthy Birthday. And so we love to share their sweet faces. And these are just some of the babies that we've had an impact on with their parents reporting that they are what we call a baby save. So I am Sarah Coleman, and I am the State Expansion Director. Today with you have the Sarah team. And so we go by our last name, Coleman and Hybels. And I'm the State Expansion Director. And generally, I have the responsibility of making sure that the word gets out in the state and that we support endeavors throughout the state to speak to fetal movement monitoring. And I'm joined by my coordinator, Sarah Hybels. Hybels, do you want to say hi and tell everybody about yourself and what you do?
Sure, thank you. Hi, everyone. I'm Sarah Hybels. I'm the State Expansion Coordinator. So I'm doing a lot of behind the scenes work for our contract with the Wyoming Department of Health, sending you all letters and emails to get the word out and education about Count the Kicks. So I do have experience in the nonprofit space, working with victims through domestic violence shelters as well as the court system. So happy to be here today working to save babies in your great state.
Thank you, Hybels. And Hybels is the better half of this team for sure. So my background, I have training as a nurse. I worked as a labor doula. And then I actually moved into the K-12 education system and worked there for quite a while. Hybels and I are based in Iowa. Our program offices are here in Iowa. I lived in Denver for about 10 years. Hybels also lived in Colorado for a fraction of time. So we miss the Rocky Mountains. My absolute favorite place to be is in the parks. And so you can find me frequently over the summer in the greater Yellowstone ecosystem, which is why I love so much that we're talking to you today in Wyoming. So we want to thank our partners at the Wyoming Department of Health. We're joined today by two of those representatives, and we are just so thankful for their efforts in getting the word out and being supportive partners, and just really want to highlight the partnership and how important it is in saving babies in the state of Wyoming. And I'm pleased to share with you a Wyoming baby save. This is baby John Walker. And whoops, let me do that real quick. Get those captions on for you. So this is baby John Walker, and I just want to share a little part of his story. I'm actually going to link in the chat for you. If you want to read more about this story, it's really impactful. And one thing that Amber, baby John's mom, said is that I'm thankful for the research I found and the Count the Kicks app. Through this information and the tips in the app, I discovered how important it was to note changes in movement, not just to notice no movement. I now stress to all new moms that they have the app, the Count the Kicks app, and that they do it every day and notice those patterns. I cannot stress enough to trust your mom gut and go get checked for any change in movement. My hopes are that all families can have happy endings just as we did. We have a beautiful baby boy and a crazy birth story to tell. And so again, I threw that in the chat if you're interested. It really is an impactful story. And while we are an evidence-based program, we also rely on the storytelling aspect. We listen, we respond to feedback, but we want to share the stories of parents that have been impacted in stillbirth. And sometimes it's not a baby save, and it's more a message from a lost parent that wants us to get this information out so that we can prevent preventable stillbirth, and that we can have an impact on those maternal health outcomes that we might have noticed a change if we had been taking a look at fetal movement monitoring patterns. So that's where we are today. Again, I mentioned that our program is here in Iowa, and everything that you're going to learn about today kind of comes down to this Iowa Strong Foundation. We have a program we'll tell you about that we saw through research studies. We've been able to prove that we've saved 1 in 3 at-risk babies just with this campaign. So this is an early warning system, and it really is just more than education. It's really having those conversations as providers and raising awareness. So I don't know how many of you are familiar with this space. This is Jen Hamilton. And last fall, we all woke up at the Healthy Birthday team to our social media blowing up because Jen had done a post about Count the Kicks. And so in her words, I want to share kind of an overview of that program. She's a labor and delivery nurse. If you don't know who Jen is, she's a labor and delivery nurse from North Carolina. She is not a Count the Kicks employee, but she is a strong advocate for fetal movement monitoring and the work that we can do to save lives. So let's listen to what Jen has to say about Count the Kicks.
Did you know that there's an app that can prevent stillbirth? Studies have shown that the most reliable indicator for an intrauterine fetal demise or stillbirth is a change or decrease in fetal movement. And getting to know your baby's movement and letting your doctor know if you have any changes is a great way to protect your baby. You don't need an at-home Doppler, and in fact, I would highly discourage you from buying one, because sometimes what happens is you can notice a change in your baby's movements and you can put on the Doppler and hear a heart rate and be like, whew, everything's fine. And if you were put on a monitor where we could see what your baby's doing, we would see fetal distress. This is a baby that's doing great. This is a baby that might not be doing great. And this is the baby that's definitely not doing great. But guess what? Every single one of them has a heart rate around 150. And with just hearing a Doppler, we don't know which one of these is your baby. There's a free app that you can download called Count the Kicks. It is a way that you can monitor your baby's movements, and it'll help you figure out if you might need to go get medical attention. I don't work for Count the Kicks. I get $0 for telling you about this. I just think that this is genius. They were able to decrease Iowa's stillbirth rate by 32% in the first 10 years of the Count the Kicks campaign. So please, take a few minutes each day and just pay attention to what your baby's doing. And if your baby's doing something wonky that they haven't normally done before, come see us. We would so much rather you come in, we monitor your baby, we maybe do an ultrasound, and we let you know that your baby's doing okay, than for you to not come in and your baby not be okay. You aren't bothering us, okay? We want you to come in. That's what we're here for.
So I appreciate that overview from Jen, and we're kind of going to get into some of the research of that. So let me turn it over to Hybels at this time.
So what we know is that on average, 40 babies are lost every year in the state of Wyoming to stillbirth. So again, because of the success that we have had in Iowa, we believe that we could save 13 Wyoming babies every year with you implementing Count the Kicks program into the work that you do with expectant parents every day. So I'd like you to introduce to another Wyoming baby saved. This is baby Lena. And her mom, Carly, was using the Count the Kicks app, and this is her story. She says, when we were 1 day shy of 36 weeks, I went in with the app data, not just a feeling, showing changes in movement. That, coupled with another barely passing non-stress test and biophysical profile, led us to deliver that day. Little Lena needed some help to get going, but we are beyond grateful to have her with us today. Count the Kicks and the responsive and attentive medical team have more than earned our trust and praise. So we are so grateful that baby Lena is here safely. And just look at that sweet face. This is why we do the work that we do.
Trying to come off mute. Sorry, I have two screens today. So this is the Norway study. And I want to you can read some of the highlights here about this Norway study, but I also like to introduce the story of our founders with this. So we at Healthy Birthday, there are 5 women who are considered our founders, and they became connected after enduring the heartbreaking loss of their babies to stillbirth. And they wanted to dedicate their efforts to preventing this tragedy from happening to other families. They came across this study, the Norway study, and this set the stage for the Count the Kicks campaign. So you can read again some of those highlights. We'll also be sending out a copy of this recording and the slides. You can link to this study if you'd like. But this really set the stage for what Count the Kicks in Iowa became. A large takeaway that the researchers found was that the more an expectant parent was paying attention to movement of their baby and documenting what was the normal for their baby, the better the outcomes for both mom and baby. And so again, that campaign was born in Iowa. So if you're interested in reading a little bit more about that the research behind that campaign and where we get that 1 in 3 number. On the left is the BJOG article. So we've been published in BJOG last winter. We've also been published in AJOG. And just to kind of lay the field for this, Count the Kicks emphasizes tracking fetal movements at the same time for every day in the last trimester of every pregnancy. And so the BJOG research shows a 1% decrease in stillbirth rates across Iowa every 3 months. And one of the highlights of the AJOG study is that 77% of respondents had a lower anxiety rate, and 84% of respondents using our app reported that they felt increased bonding from using our app and doing that fetal movement monitoring. And we're excited. This is brand new, like brand new, 10 days old. A1, many of you I see are nurses. If your specialty is OBGYN, then you probably are linked into A1, and they've recently released a practice brief addressing decreased fetal movement. And there's a highlight there that you can read, but basically this practice brief sheds light on various aspects of fetal movement, emphasizing the need for education during pregnancy and interventions to ensure the health of both mom and baby. These key components align seamlessly with our evidence-based stillbirth prevention program, which is Count the Kicks. So a little bit more about that Iowa data. This is the Iowa data for the life of our campaign through 2022. The red line at the top represents the national stillbirth rate, and the teal dots and trend line beneath that, that's our Iowa rate, starting in 2003 and going through 2020. Where that blue dot meets the red line at the top, that's 2008. That's the year that the campaign started in Iowa. And you can see that there is a trend line down from there. It's important to note that the majority of the United States remained stagnant throughout this time, whereas Iowa's rate was continuing that decline. There's always going to be some fluctuations, but it's important to really look at those averages. Things like a large syphilis outbreak or outside factors, the pandemic is one, can cause a spike and can cause those changes. So it's important to note that as we look at this data, we're continuing to monitor it, and we're continuing to look for the impact that we have. And we really want to replicate these results in the states as we go into them. So something else to note is thinking about the disparities that persist. And I want you to know that Wyoming has been very cognizant of disparities and thinking about population impacts, even so much as we go into the materials later today. We made changes to our graphics that reflect the Wyoming population. And so we have really talked a lot about the disparities that are happening right there in the state of Wyoming. So as you can see from the numbers, these numbers were updated recently. We've actually had a slight change. It used to be 1 in 173 pregnancies and in stillbirth, and now it's 1 in 175 pregnancies. So that's showing a little bit of that trend improvement, but again, that's across the United States. It's also important to know that stillbirth rates mirror infant mortality rates. So meaning that roughly the same number of children being lost to stillbirth in a year are also being lost within that first year of their life. And why we bring that up is just to highlight, probably most of you are familiar with the Back to Sleep campaign, but people aren't talking about stillbirth in the same way that they're talking about back to sleep. As soon as someone gets pregnant, as soon as they start speaking with a provider, a lot of information is given about back to sleep, and that is fantastic. And we want those babies to be saved as well. We just want to open the door for the conversation for stillbirth to enter as well. So as I mentioned previously, there's a large divide when it comes to those who are more likely to experience a stillbirth. And I just want to highlight a few things that research has shown to be some contributing factors. You can see them here. Something that I'm interested in as I was studying, doing my MPH, I got really interested in epigenetics. And so just looking at those early experiences and the historical trauma that's present, we know that environmental influences and things like trauma can definitely affect the expression of genes. So these life experiences rearrange those epigenetic markers that govern the expression of genes. And so as genes change and release the information, that shows up. And so we know that that can impact stillbirth rates. And it's extremely important that we pay attention to the research, that we move that forward so that we can understand more about that expression. But then there's all these other things that also contribute to these disparities. And at Healthy Birthday, we are invested in our work reflecting how we can make an impact on that. So in particular, you'll hear us talk a lot about access to healthcare today and some of those socioeconomic barriers, thinking about health literacy. That's really important, and we'll highlight that today. So moving into that, and just to address it a little bit more, we can actually provide another update to you that our app is going to be available in 20 languages very shortly. We're working to add 4 new languages to our app. And so that just means if someone downloads the Count the Kicks app, they can select from 20 languages how to see all of that information. And that's really important to us. Making sure that people have that access. And then other things that we do, we have social determinants of health surveys that we're monitoring. We have our kick counting bracelets. Those are available in the state of Wyoming. We've worked with some of our nurse partners. So we're getting them out. We're getting some feedback about how they work in the state of Wyoming. So stay tuned on that. And then just thinking about the approach that we can have with non-traditional providers. We want to work alongside non-traditional, non-medical places in expansion states. Things that you might not think of, such as libraries. We've been contacted by libraries in other states that say, hey, we have a lot of people coming in here they use our computers for job searching, to get some of their basic needs met. They might come in for family story time. And we've been contacted by libraries who want to have the materials there because they want to be a part of their community getting the word out. So that's why I say non-traditional spaces. Other things can be houses of worship, salons, with clinics. There's just a whole variety that we can have to open up the door. So before we talk about the materials, and because I've just talked to you about who this can be shared with, and I'd like you to just take a minute to brainstorm 5 people that you could share information about Count the Kicks with during the course of your work week. And I'd also encourage you to think, and this can be something that you put in the chat, Hybels is making sure that she monitors that. What do you need to know in order to talk about Count the Kicks? So I'd love for you to just take a minute to think about those 5 people and just jot some notes down, and we will move on. So let me kick it over back to Hybels.
All right, so now it's time to talk about our free materials. So I'm going to put a link in the chat to where you can go and order our free materials right now. So in the state of Wyoming, we do have brochures, app cards, and posters that are free for you to order today because of our partnership with the Wyoming Department of Health and the Maternal Child Health Unit. So these are brightly colored materials that are easy to use. And we also have at a glance materials that are more picture based. As Coleman was saying, we have those wonderful kick counting reminder bands. Those can also be used by expectant parents that don't have internet access or cell phone service. So we're going to give you some time right now to go to our website. Again, use the link in the chat or the QR code. We're going to play some music. If you order during this time during the webinar, you will be entered into a drawing for an Amazon gift card. So take a few moments now and place your order for our free Count the Kicks materials.
It might seem crazy what I'm about to say. Sunshine, she's here, you can take a break. I'm a hot air balloon that could go to space. With the air, like I don't care, baby, by the way. Because I'm happy. Clap along if you feel like a room without a roof. Because I'm happy. Clap along if you feel
Great. Thank you, everybody, for those orders. And we just want those materials to make it easier for you to talk with the expectant clients that you serve about tracking fetal movements in the third trimester. So let's talk a little bit about why a baby's movement may change when they're in distress. So movement is one of the very important ways that a baby communicates before birth. A change in the baby's movement can be an early and sometimes the only warning sign that the baby may be in distress. So just like when we're not feeling well, we slow down and babies are just the same. So when we have COVID or the flu or a cold, when we're not feeling well, we change our activity levels. We may lay in bed or on the couch and we're just not participating in those daily activities like we usually do. We slow down and babies are just the same. Babies' movements can become weaker when they're in distress because they're naturally preserving the blood flow to their vital organs, such as the brain and the heart, just as Jen was referencing in that video you watched at the beginning of our presentation. So again, this change in movement may be the first and only warning sign that something is wrong with the baby. So when should we start counting movements? ACOG recommends to begin counting movements at 28 weeks of gestation or 26 weeks if considered high risk or carrying multiples, because this is when research indicates that baby has established a consistent movement pattern that expectant parent can track. And then what movement should we be counting? We really want to be counting all those movements: rolls, kicks, jabs, swishes, pushes, punches, really everything except for hiccups, because hiccups are involuntary. So now we've talked about why it's important to track the movements, when to start counting, what to count, and now let's talk about how to count those movements. And this is our free Count the Kicks app. As Coleman was just mentioning, we're soon going to be available in 20 languages. Our app is totally free. It's been downloaded over 200,000 times. There's no advertisements or pop-ups to distract from a kick counting session. And we regularly survey our app users and listen to their feedback so we can make changes and improvements. With our app, you can track for twins and future pregnancies on the same profile. And you can also manage your profile on different devices. So one day you could count on a cell phone, the next day you could use our web-based kick counter. And the goal for our app is we want expectant parents to learn what is normal for their baby's movement patterns. We know that every pregnancy is unique and every baby is unique. So we want those expectant parents to know how long does it take their baby to get to 10 movements. And then because they know what's normal for their baby, we want those parents to feel empowered to speak up if they notice a change in those movements. Our app is also available on Apple and Android. And to start counting, you simply tap that blue footprint that you see on the screen. The timer will begin. And you want to tap the footprint every time you feel one of those pushes, swishes, punch, or jabs. And after 10 movements, the timer will stop. And if you are a registered user, which we highly recommend, that data will be downloaded to your account. If you get interrupted during a kick counting session, you can restart the session or delete a kick if you accidentally track one. You can also set up a daily reminder for the app to remind you to count the kicks. And so again, after a few days, we want the parents to start to see what is the normal movement pattern for their baby. How long does it take their baby to get to 10 movements? And if they notice a change, they feel empowered to speak up. And we want you to really get to know our app. So please feel free to download it, play with it, so it's easy for you to explain to the expectant parents that you serve. Another great resource we have on our app is the Find Local Resources page. Registered users can search by zip code for free and reduced cost services for things like food, housing, childcare, diaper banks, and mental health services. So just another amazing feature of our Count the Kicks app.
So thanks for hanging in there with us. We are coming around the bend to the last part of our presentation, and we want to give you the tools to also talk about stillbirth prevention. So you have the materials, but how do you provide information to meet patients or clients where they are? We have some suggestions for you about improving the conversation around stillbirth, and we also note that these can also be used to increase the health literacy for patients So the first strategy would be around being equitable. And you probably know a lot about equity. This is why we have our at a glance materials that we really lean into those, and we're kind of cutting out on some of that jargon, which is going into that be clear and concise. But it's interesting to note, higher education does not necessarily mean that somebody has high health literacy. So even patients that have high levels of literacy can have difficulty understanding health information and services. So making sure that we're saying the same thing to everyone is really important. And then asking open-ended questions as you talk about fetal movement monitoring with your patients. Just be really intentional with the language that you use. So open-ended questions allow you to learn what the parent knows and understands. And it's a little bit different than saying, is your baby moving? That's a yes or no response for most people. But if you say, tell me about your baby's movements, they're not going to be able to respond with yes or no, right? They're going to have to provide some context to that answer. And if you say to them, how is tracking your baby's movements going? Tell me about the time of day that you notice your baby moving. If you're asking those kinds of questions, that allows you to hear what the patient is experiencing. And another example could be, what kind of questions do you have about your baby's movement? And again, that can go into that reteach, which is listed as another step here. So a lot of this just ties together, and being aware of that. So being clear and concise, avoiding the jargon that's available. It's really easy. I come from both worlds, the medical world and the educational world. We have tons of acronyms for everything, and it's easy to kind of start to talk through things using that jargon, but then you may risk alienating how the patient understands what is happening to them and what risks are, and just being able to access that information. So again, our educational materials through the campaign, they're very parent focused and they're empowering and easy to understand. And you can see a difference with our picture-based materials versus the traditional. That for people who really want a lot of information, the traditional materials meet that need. But if we're just trying to catch the attention of someone and we want to simplify that explanation, picture-based materials do that for them. So it's important to be honest and speak with empathy and compassion. We know pregnancy is full of risks that we should educate parents about. Stillbirth should not be the exception. And this goes back to the beginning of the presentation when I talked about the Back to Sleep campaign. We don't want this to be in silos. It is a risk. It's important for people to talk about it. And it's also something that we know, just like putting baby on the back to sleep, that if we're doing fetal movement monitoring, the chances are greater to have a successful outcome, not only for baby, but for the expectant parent as well. So educate on kick counting, that fetal movement monitoring, and encourage a parent to speak up. I think maybe that's something we haven't highlighted enough today. This campaign allows someone to speak up and say, I know something's different. I look at the app, I look at the data, I look at the trend. This is why we encourage registered users. They're going to see more than a few days. They're going to see that whole trimester of pregnancy that they've been counting, and they can say something is not right. That's an empowerment tool. And so we just really want to highlight that's part of the equitable strategy as well, is giving people, having them feel empowered to speak up. So just around the reteach, if a patient displays some confusion, provide resources to them. And you know what, this is what I know from being a health educator in a K-12 system. If you don't know, tell them, I don't know, but I will get an answer for you. It's okay to say that. So just determine how you're going to handle questions that you don't know and provide that feedback loop so that you complete the reteach. That's really important. So getting into that, we just want to highlight a couple misconceptions that we've heard. Now we've heard a lot, and we would love, if you've heard misconceptions, we'd love for you to put them in the chat, because what we do is we build a frequently asked questions document on our website, and we just update that. But we want to be able to give you the tools to talk with patients about concerns that they have. So here's one that we hear, is that my baby should get 10 kicks in 2 hours. We did a webinar in a different state yesterday, and that question came up in the chat. So every baby is different. So here's the deal. Every baby is different. And the recommendation is to expect that you're going to get these kicks in a certain amount of time. But what does that time look like? It's really important that you start to develop the normal amount of time. You develop that point of reference for what is normal for the baby. And that's why we say start counting at the beginning of the third trimester, because within a few days, you notice those patterns. You notice the strength of those movements. You notice different things about that baby. That's the bonding that can happen between the expectant parent and the baby. So we're not so much focused anymore on 10 kicks in 2 hours. We're focused on a normal pattern of movement, and we're focused on the strength of that movement. And if someone notices that it's different, we want them to get checked out. We want them to, if you're the provider, we want them to contact you and say, something's different, something's off. And have that conversation with you about what the next steps are. I will say in a rural state, like you guys have a lot of rural areas. Iowa has a lot of deserts, maternal health deserts. If make the decision as a practitioner, if they try and contact you and they don't get a response within so much time, like 30 minutes to an hour, maybe it's 2 hours. Do you want them to just start heading into the hospital to get checked out or the birth center to get checked out? That's something that you can do as part of the system integration, and then communicate that with your patients. That's really important piece. And we'll get into systems integration before we're done with the webinar. But just make a note of that would be an important protocol to establish with your patients. So here's another misconception. And I don't know how many of you have had the pleasure of meeting COVID or the flu this fall, but I met COVID over Thanksgiving and my birthday, and it was miserable. And so I thought about this exact point. And Hybels talked about that a little bit earlier with movement. So the misconception is if baby isn't moving, drink something cold or eat something sugary to get baby moving. Well, if you're sick, if something's wrong, you don't want to move, but you can move. So in the example of COVID, yep, I could do my job if I drank some Dr. Pepper, right? I would not feel good, but I would do the things that I needed to do in many cases. And so that's really, it's a false sense of what the movement is. It's not normal. It's an intervention that's been applied. And so research has really moved away from the idea that sugary drinks and things like that are a good way to get baby to move. And you'll see that if you get into the A1 practice brief, that's one of the things that they highlight. These fetal movements are best monitored without an intervention. So if baby isn't moving normal, they need to speak to the providers and get that information. So I told you we were going to systems. This is systems, and then we are going to be done for the day. So let's think about how you can integrate Count the Kicks into your current system. And we base this on what partners in other states have told us, what practitioners have told us. First, make sure that everybody on your team knows about Count the Kicks. Do you have someone that's assigned to make sure that you have materials? Do they know how to go to counttthekicks.org and order these materials? Again, these are free. Thanks to the Wyoming Department of Health. You can go on here and order materials, and we want you to have these in place to give out to expectant parents. So thank you again to the Wyoming Department of Public Health. This webinar is being recorded. Share it with your team. Make sure that they see that information. Hybels and I have our information, our email information. We are always happy to answer questions. So make sure your team knows how to get in contact with us. Think about paperwork. So when you think about the paperwork system that you have, intake forms or action plans, we have a whole another webinar that we do that's kind of a little more into this integration, but we have after visit summaries, we have phone call scripts that can be recorded. There are ways that you can integrate so that people are getting this message. And is this a question that should be an EHR? In Iowa, it is. So as people get checked in to all of our hospitals, this is a practice that is something we see in all of the hospitals in Iowa. Thanks to our Perinatal Quality Collaborative, that is a standard of practice, is just asking about Count the Kicks in the third trimester. So could that be a part of your EHR as people are checking in? And then discussing at parent meetings. every touch point, there should be conversation, especially in that third trimester. But before then, talk about the importance of fetal movement monitoring. Tell them about the app. Tell them about Count the Kicks and how important it is that they're paying attention to those movements. Encourage and empower your parents to talk about this at every single touch point in the third trimester. And then finally, share this far and wide. It's really because of you that this program can be successful. So as you're paying attention today, if you may have known about Count the Kicks before, that's great. Were you sharing that information? That's why I asked, who are the 5 people you can share that with this week? If you are not in a clinic, if you are a WIC, if you are somebody who works in a WIC clinic, if you're a home visitor, there's an opportunity there to get the word out and to make that part of your practice with expectant parents. So it's because of you that this program can be more successful in Wyoming, and you will be a part of lives saved.
Okay, now we'd like to highlight another great resource we have, and those are our Count the Kicks ambassadors. These are women all over the nation that are working hard to share our Count the Kicks education and messaging throughout the state. Many of these women are lost moms, birth workers, doulas, nurses, and they're passionate advocates due to their personal experiences. So they're kind of our boots on the ground. They're helping us with medical conferences, baby fairs, give media interviews, and fundraise, and just are great partners for us as we try to spread the word throughout the United States. And now I'd like to introduce you through our next video to Dana and baby Save Nala. Dana was using the Count the Kicks app, and when she noticed a change in Nala's movement, she spoke up for herself. Listen to their story here.
She came back in after she had me put on the monitor and stuff, and she's like, we're just gonna take her. And I'm like, what? And she's like, you know, her heart rate is dropping every time you have a contraction. I was already scared, you know, because I was a high-risk pregnancy. So I basically learned from the doctor's office, the little yellow sign that was right there. When she started moving, I was very alert with her movements, you know. That was what I lived for, just because I wanted her to, you know, her to make it and survive. When she started moving, she moved, and she was consistent. It was always at a certain time. Nala was a kicker. When she started kicking, she was kicking. And this day, she wasn't moving at all. I started drinking cold water. I mean, I was drinking so much, my stomach was hurting to make her move. And she didn't move at all for me at all that time. So I'm just like, okay, I'm gonna get her checked out. It was the heart rate that was dropping. Like they said, her heart rate would drop real low every time I would have a contraction, and they were like back to back. She thought that it would save the baby, so she pulled her out. She was like, it's a good thing you came when you did, you know what I'm saying? Because if you wouldn't have, you know, we probably wouldn't be having the same outcome. I think about it every day, like, oh man, what if, you know, what if? Definitely to pay attention and count the kicks, you know. I feel like it's important just because had I not, you know, knew to do that, Nala wouldn't be here. Don't second guess yourself. Don't feel bad or stupid. Don't worry about insurance or the emergency room bill. Go check on your baby, you know, because your baby might not be here. You just pay attention, you know, seriously. Like, it's your baby's life.
All right, so before we go today, we'd like to share with you some of our social media tools that we have. So these are the accounts. The Healthy Birthday account is focused on maternal health outcomes, stillbirth advocacy, legislation movements, and Count the Kicks is a little more parent focused, but we encourage you to engage with the materials that make sense for you. So there's QR code here for our newsletter as well. And just want to make sure that you get your orders in today. We're giving away those Amazon gift cards. We'd love to send them to the state of Wyoming. So make sure that you get those orders in. If you don't know what to order, just order a sample today, and you can always order more. These materials are going to be available. Again, Wyoming Department of Health, we are so grateful for that. And we'd like to, here at the end, let me stop sharing my screen, just give you an opportunity if there are any questions that you have to ask those questions. And I will think I've got a spot for us. If you don't want to type in the chat, I can launch our wonderings poll. So what are some wonderings that you have about stillbirth related to your work? So you're free to put anything in the chat. If you're done for the day and you will watch the recording and look at the slides later, thank you for being here. We really appreciate you. Otherwise, Hybels and I are going to hang out for just a couple minutes and answer any questions that you might have. So thank you again for being with us.